Hey, welcome everybody. Today is February 15th, 2023. And I know I said I was going to take a break from doing Wednesday webinars, and maybe I'm too much of a narcissist or exhibitionist to really take a break. But what seems to happen is people send me stuff and it kind of makes me feel like, doesn't make me feel like, but I end up thinking I need to comment on this and I don't feel like writing about it. So I end up deciding to do another Wednesday webinar. And so I hope that's okay. But that's how this one came about. I am planning on taking next Wednesday off and preparing for the summit on the following Saturday. And that preparation is going well. We're getting everything organized. We've got all the different participants in line, and I'm preparing something which a lot of it will be new material. So again, I hope everybody joins me. So this one came about, again, which I didn't think I was going to do, but there was a couple principles that I wanted to highlight in this, which seems to flummox people. And I was going to say this later, but I guess the question in all this, which I've dealt with probably 100 times or more, why does this matter? And let me show you, I'm going out of order here, but why this matters. So first of all, this is that we have the right conception about biology and medicine, and specifically the misconception called a virus. In other words, why does it matter that people come to realize that there are no viruses? This is a historical misconception that in a sense has been weaponized or used against us, us being the people of the world, to our detriment. And to put it another way, the virus theory, which is a subset of the whole germ theory, is a basic component of a worldview that is a domination worldview that was espoused by such people as the Rockefeller medicine cabal. And I more and more have come to the opinion that unless we get rid of this misconception and this whole domination worldview, that we cannot live the lives that humans were meant to live and create the world that we know we can create, because it's based on a worldview which is A, wrong, and B, toxic. So here's an example of what I mean and why this is so important. This was a clip that I saw today. So the World Health Organization calls urgent meeting on killer virus. 9 deaths and 16 suspected cases have been reported so far in a new Marburg virus outbreak in Africa. And so they go through the urgent meeting. And of course, they say that the Marburg is highly infectious thanks to rapid and decisive action by Equatorial Guinea, I guess, authorities. Emergency response, we're going to save lives and halt the virus as soon as possible, says the regional director. And by the way, they're going to get to work on developing an mRNA vaccine specifically for the Marburg virus, specifically targeting the people of Africa, who, by the way, did not seem to get the COVID injection with the high enough rates or to the rates that most of the Europeans got it. So this is a weaponized play to gin up another virus story to target one of the few remaining peoples who didn't fall lock, stock, and barrel for the whole COVID scam. So those of you who think this may be over and that we are done with the virus narrative, that is far from the case. We are as far away from that as you can possibly be. And that's why I think I need to keep going here. So this was there's a couple points I want to make about this clip. So first I'm going to show this clip. It's about 2 minutes or so. And this is an interview from an organization called the Last American Vagabond, and I don't know much about them. I may have been interviewed by them, but I don't really remember. And Peter McCullough, who I'm sure most of you have heard of, and hear what he has to say. And the only thing I'm going to say in the beginning is one would think with a name like Last American Vagabond, I'm not sure exactly what that means, but it connotes, at least to me, a kind of rebel organization, populated by rebellious people who are not falling for the dominant narrative. And all I can say is the virus narrative is about as conventional domination, mainstream narrative as you can get. So let's take a listen.
Two-thirds of that occurred during the Omicron outbreak. So this is very important. We have data now, Delta going forward, that if someone has had an illness with Delta or Omicron, the immunity is basically so fresh and in tune, to complete immunity, that if another infection occurs, and there's about 60% protection of a prior infection protecting against a future one. But if a future one occurs, there is a negligible chance for hospitalization and death. And the paper is by Chin and colleagues in the New England Journal of Medicine in October of 2022. 59,000 prisoners, 17,000 staff.
So let me just say what he's saying here, and you can see that the vagabond people are nodding in agreement. So apparently they agree with this. He's basically saying that we have a internal medicine JAMA paper that shows that if this is your second infection, that you have a negligible chance of getting hospitalized. So we're going to take a look at that paper in a minute here, but let's finish this clip.
In a congregate setting, and they know who gets sick and who doesn't. And I'm telling you, if you had prior infection, in that study, there were 0 hospitalizations in that, 0. And it didn't matter if you took a vaccine or not. The vaccine was irrelevant. So nowadays, when I get a call from a patient, they say, Dr. McCullough, I've got COVID. My first question is this your very first case? Like, you know, if it was you guys, that's what we call an index case. If it's an index case, I say, ooh, this could be more severe. We'll need a multi-drug protocol, McCullough protocol, or FLCC. So when Kim got it, it was.
So again, he says the most important question, is this your first case or index case? And by the way, he also has an online clinic that he's set up. So I guess you could say he's a little bit of a competitor. So this may be a little bit unfair of me. But anyways, so if this is your first or index case of infection, then you need a multi-drug protocol. He doesn't say in here what his multi-drug protocol is, and I must admit I didn't bother to look it up. I don't know if he's talking about remdesivir or the sort of newer antiviral so-called. But if this is your quote index case, your first infection, then obviously you need the whole pharmaceutical array, ivermectin, hydroxychloroquine, et cetera.
Index case, she needed treatment. If she got a second case now, after coming here, which could happen,
So it's an interesting, there's a little bit of by the way, people going to a live place and going to a conference and meeting other people, of course, you could get sick again. That's the whole point of all this, is that being around other human beings, and you can see everybody's laughing at that, like, oh yeah, we all know that. Being with people is a dangerous thing to our health.
I think it's going to be much more mild. The second case is almost exclusively use over-the-counter solutions, a virucidal nasal sprays.
A virucidal nasal spray and nutraceuticals, of which, of course, he has a whole protocol.
Nutraceuticals and supplements over the counter, and we get people through. So this idea, I've actually changed on my Substack, Courageous Discourse. I changed risk stratification.
Okay, so that's what he says. Let's take a look at the paper. So he says there's a paper from Chin et al. So here it is, JAMA. Can't see where the chin is in this, but I'm sure there's a chin in here somewhere. But I'm pretty sure this is the correct paper that he's referring to. So as always, we want to, because this was October 2022, that's the one he mentioned, and it's from JAMA Internal Medicine. So this must be the right paper. And it was all about who gets hospitalized and outcomes depending on whether this was your first or second infection. Now, the key part of this whole thing, as I'm sure everybody is aware of, is, Tom, how in the heck did they know these people had a COVID infection or an infection with SARS-CoV-2? And so we go down to the methods, because that is the key question to ask. The key question to ask is not, is this your first or second infection? But the key question before anybody says first, second, 100th, 1000th, or whatever, how do we know this is an infection? So we go down to description and data collection for all COVID net cases, and they say it's a population-based surveillance system in 99 counties, 14 states, approximately 10% of the US population. Hospitalized patients residing in a surveillance catchment area with a positive molecular or rapid antigen detection test result for SARS-CoV-2 during hospitalization or within 14 days before admission are included as COVID net cases. So there it is right there. In other words, the definition that this whole thing is based on, whether it's your first or second or 100th infection, is based on a rapid antigen detection test. So the question there is, where is the paper that shows that this antigen, in other words, a protein detected in your snot or your mucus, actually came from the virus called SARS-CoV-2? The answer, if you go look in the specs for the rapid antigen detection test, is the rapid antigen detection test was validated based on its correlation with the PCR, or specifically the RT-PCR, quote, test, which is not a test. So that is the only validation showing that this antigen came from a virus, is that the results correlated in a high percentage of cases with results from a PCR test. It's the same with an antibody test. The antibodies are validated against the antigen test. In other words, they find a protein which they call an antigen, and they see if there's a protein which they call an antibody that matches up with that antigen, and then they see if the antigen matches up with the sequence that they're finding in the PCR process. And these are essentially three, they call them three independent measurements, but the reality is they're all measuring the same thing, which is the sequence matches the protein, matches the antibody. Those are all looking for the same thing. At no point in any of this process did any of these three measurements validated against a particle called a virus, specifically SARS-CoV-2. In fact, they were validated, in other words, proven to be from the virus, because they matched up with the PCR test. So then you have to ask, what led them to say that the PCR process, i.e. they call a test, matches up to the virus? And so there you have to go all the way back to the original quote, finding of the virus based on the Fan Wu paper, which became the basis of this is the quote genome of the virus. So we take little pieces of that genome allegedly from the virus, and that becomes the PCR quote test. And that little piece becomes the antigen, which we detect correlating with that PCR test, and that correlates with the same antibody that correlates with the antigen, which correlates with the PCR sequence. So where did the Fan Wu sequence come from? Well, that they took one person who they said allegedly had a new disease, of which there was no evidence of. They ran a sequencing analysis on their snot with two different metagenomic sequencing programs, one called MegaHit and one called Trinity. And here's where it gets even more interesting, and I can't remember which is which, but I think with Trinity, although it could have been MegaHit, they got approximately 400,000 plus different possible genomes. The longest was about 12,000 base pairs. With the other program, I think MegaHit, they got over 1 million possible genomes, basically by aligning the little pieces or assembling the little pieces of the genetic sequences in the snot and amplifying that with PCR, if that's what PCR is in fact doing. And so then they got over 1 million different possibilities. Now, here's the important point, or one of the first important points. If they had just used the Trinity program, they would have said this is not a coronavirus, because the longest sequence was 12,000 base pairs, and that's nowhere near a match for the previous coronaviruses. So if it had been only the one program, there would be no coronavirus. So instead, they chose the longest of the sequences from the other program and said, as we have heard over and over, that's a 90% match, which isn't a match at all to previous coronaviruses. Therefore, it is a mutated but new coronavirus. That is ridiculous reasoning. But it even gets worse, because now different bioinformation experts have actually taken the raw data, in other words, the little pieces, and put it into the MegaHit program. And to their shock and surprise, they are not able to come up with the assembly of that same approximately 29,000 base pair genome. In other words, not only was that particular genome completely arbitrarily chosen as the genome because it was the longest and the closest to previous made in the same way coronaviruses, but it turns out they didn't actually even come up with that genome. They had to use basically fraudulent addition techniques or adding certain sequences to the final sequence to even come up with a genome which was even somewhat close enough so that they could say that that was a match to the previous coronavirus sequence. But even that sequence does not even exist even in their own program, because you cannot repeat the experiment and get that same sequence. That's besides the whole point, that that sequence was never correlated, never attempted to be correlated, in no way correlated in any way with any particle that exists in nature or in that particular person, or that has been isolated or causes disease or spreads between people. It is a complete fiction, or as they now say, it's turtles all the way down. So in other words, using this assessment to see whether this is the first or second or 20th or 100th infection is complete nonsense, has no relevance, because there is no correlation at any time with any virus at any point in this process. And so all the rest of the method and results with lots of charts and graphs, and whether it's your sex and Hispanic or Latino, or whether you have diabetes, none of that has any correlation with any kind of virus or infection. Now, some people will ask, well, how come these three things correlate? How come the PCR and the antigen test and the antibody, they correlate? And the first important point of that is they may correlate with each other, but they don't correlate in any point with a virus, nor have they ever been attempted to be correlated to a virus. And so the reason why they correlate with each other is they're essentially measuring different aspects of the same thing. And again, I think this is best described by an analogy. It's like if you say, I have 3 independent proofs that there's a Santa Claus. Number 1, the cookies that I left on the table are gone. Number 2, I've seen pictures of Santa Claus. Number 3, there are presents under the table. I could go on. Number 4, Joey was really good this year, therefore he got presents, whereas Francis, he wasn't so good this year, so he only got a lump of coal. And you could go on with things that all correlate with each other, and you would have a 95% confidence ratio that there was, in fact, a lump of coal, and the cookies were eaten, and there are pictures of Santa Claus, and on and on and on. At no point was there any correlation with anything real, i.e., actually Santa Claus. So essentially, that's what they're doing. These are not independent assessments any more than cookies and pictures and whether anybody was bad or not is an independent assessment correlated with the existence of something called Santa Claus. Now, the other thing that I couldn't find in this, but I was told, is that Dr. McCullough threw out a kind of challenge. Well, if it's not a virus, how do you explain that some people are getting clots? He said. Which is the same sort of thinking is there are invisible exploding unicorns blowing up buildings in the Ukraine and Lebanon and all over the world. And how can you account for the fact that there are blown up buildings? So the first thing is no virologist would claim that they have proven the existence of a virus because certain people get clots. In fact, if you actually look, there are lots of reasons why people get clots. Here's an interesting letter I got from an ICU nurse. I tell people I'm an ICU certified RN. I specialize in medical ICU patients. This includes people with pulmonary infectious disease. I explain to people that everything the news is telling you about what is going on in the hospital and ICU, I experienced every year since my first job in the ICU in '91. My first job out of school was at a nursing home over 30 years ago, and everything being told about what is going on in nursing homes has been going on forever. I tell people that I made a living caring for people that got sick and for multiple reasons ended up in the hospital on a ventilator. I plainly state that the hospitals and all the neonatal, pediatric, and adult ICUs have always been at least 75 to 80% full in the summer and 98 to 100% full in the winter, including ICU overflow units. It's normal for at least 80 to 100% of all patients in all the ICUs to be on ventilators. People are interested and engaged in the conversation. As soon as I say that in 2020 nothing new happened, people turn into the robot from the old TV show Lost in Space. This does not compute. This does not compute. They look at me like I'm nuts, accuse me of saying that no one is sick, and they say things like, I or someone I know tested positive, were sick, and someone I know is in the ICU on a vent or died. I answer them and literally say, yes, people are getting sick, going to the hospital, ending up on ventilators in the ICU, and some are dying, but this has been going on for decades. People repeat what they said before and include symptoms they or people had. So what are the symptoms of a blood clot? And so here you see all of these swelling, soreness, etc. People have blood clots for all kinds of reasons. What are the symptoms of COVID-19? Pretty much the same, or a lot of things that are similar. I'm not saying that they're all the same, but a lot of things are similar. By the way, the antigen test that was referred to has not been cleared or approved by the FDA. It's only under the emergency use authorization. So are blood clots a unique symptom to a virus? First of all, there is no evidence that the virus exists. So how would you know that the virus is causing the blood clots? I would love to hear Dr. McCullough trace those two and say that that is a new and unique symptom that couldn't possibly be caused by something else. And in other words, if you don't know why those buildings got bombed, then the default position is it must be the invisible exploding unicorns. That's the thinking that's going on here. And we heard this in a debate the other day. If you can't tell me what else is causing people to get sick, then my default position is I go with the dominant narrative, which it therefore must be a virus. That is magical thinking. The process is they are making a claim, this is a virus. That's what has to be proven, whether you can say whether you know what those symptoms are from or not. That should be clear to anybody. But just in case you don't know that yet, so is it the cold? Is it the flu? Is it COVID? Is it RSV? They basically have the same symptoms. So even assessments that have a symptom survey along with the bogus antigen test, how can they possibly know that if you have a cough, it's from COVID and not the flu or a cold, or if you're fatigued or body aches or et cetera? So what about, is there any other possible reason why people have blood clots? Well, here's two articles just on a cursory look that show that radiation sickness has all the symptoms, including damage to the endothelial lining and blood clots. You can see this in an article called The Commonalities Between COVID-19 and Radiation Injury. forgetting about the fact that they had no way of knowing whether anybody had COVID-19 or not. So the paper is obviously flawed. All they can say is both conditions initiate a cytokine storm, and both conditions have symptoms of blood clots. Here's another paper. Again, even though it's very flawed paper, I'm sure some of you have seen this, evidence for a connection between coronavirus 19 and exposure to radio frequency radiation from wireless communications, even though there is no coronavirus disease 19. So the paper is flawed, but what they can tell you is that wireless radiation is a ubiquitous environmental stress, and it creates all the symptoms, and they go on to say, including blood clots and all the rest of the symptoms, which we erroneously ascribe to. Here's hypercoagulation, impairs the microcirculation. So all this is clear. There is a clear correlation between a variety of environmental toxins, such as pharmaceutical drugs, including some of the ones that apparently Dr. McCullough is recommending to those who he claims have the first infection, even though the test and the symptoms that he's using to claim first infection have never been validated and are not even approved by the FDA, except under the bogus emergency use authorization. So the whole argument falls apart. There is no new symptom called blood clots, which is unique to a new, quote, disease called COVID. None of these tests, none of these studies have ever been correlated to an actual virus. That is easy to demonstrate and easy to prove. And so the whole narrative just falls apart. Now, what was the other part of this? One of the things that is becoming more and more clear to me is that one of the biggest problems we're having is that people who are in the, quote, freedom community, who go on to shows, podcasts, interviews, events, etc., and nobody seems to question them about the basic science. I don't know whether it's a matter of politeness or whether they don't know the science. They don't know how to ask the questions. They don't know how to ask a simple question. Dr. McCullough, I'm a rebel and a vagabond, and therefore I don't believe in the normal narrative. I know that the current scientific paradigm is used to enslave people and tyrannize people and separate people. And I don't buy it. And my whole show is based on, we look at things in a different way here. Dr. McCullough, can you please explain how you know these people got infected with a virus? Can you follow that whole chain of events rather than nod and say they need pharmaceutical antivirals? And by the way, how did you demonstrate that these so-called nutraceutical antivirals or over-the-counter antivirals, how did you demonstrate that they actually kill viruses and kill viruses in you? Because I know how they demonstrate that. They basically put it in a cell culture, and the cell culture doesn't die as quickly, and they somehow say the increased length of time before the cell culture dies somehow means they've actually killed a virus. This is crazy thinking, but this should be the responsibility of all ethical, responsible, informed journalists and podcasters and interviewers to ask these people every single event, how do you know these things you are saying? Because I know this paradigm, this way of thinking, this victim mentality that you've been dominated by this unseen virus and therefore have to separate and not go to events and not be around your loved ones and wear the face diaper thing and the whole bit and take toxic drugs. How do you know this is based on good science? And they never asked that. And when I said I'm going to have a call for help, my call for help is, this is where I need all the people who listen to me, who also listen to various podcasts and interviewers and other things that they may also respect for different views on different things. They need to know that it's time they start holding everyone, myself included, everyone's feet to the fire and start asking the hard questions. Because as I said in the beginning, and the Marburg hoax is just one more example of that, as they're now going apparently to target the African people who didn't fall in line so much with the COVID thing. We cannot build the world that we want while still believing in that domination-inspired paradigm of the germ theory. It just won't happen. We need to change the way we see the world. We need to change the way we think. And everybody that we encounter who is in the public sphere, who is speaking out of that paradigm, needs to be challenged. And the only way that's going to happen is if all of you get involved and say to people in a very cooperative, friendly, polite, respectful way, hey, last American vagabond people, here's the science. It's time for you to ask all these people who come on here, how do you know this is a virus? How do you know this is a first infection? What are the steps that they used? How do you know something is an antiviral? We need you to be our mouthpiece and our questioner and ask people this over and over again so that we finally see if they can stand up to scientific scrutiny, because at the end of the day, we know that they can't. That's when things are going to change. People are going to realize that this emperor has no clothes and we don't need an emperor in the first place. We're heading towards a kind of voluntary freedom society, I hope, or I think, or I'm expecting that to happen, and want to participate in the birth of something like that, which maybe we've never seen before. And these old way of thinking, they just have to go. So that is my call for help. And that is my analysis of what I heard. And I think that's pretty much all I want to say. One final thing, which is a bit of irony here, is I saw the announcement of the World Health Organization today. Apparently, they're going to abandon their plans to investigate the origin of COVID/SARS-CoV-2. Because obviously, they say the reason they gave was the Chinese are not cooperating. It's a bit like saying, again, if you put this in another context, so we think that the reason the buildings in the Ukraine are being blown up is invisible exploding unicorns. That is the dominant theory. Now, unfortunately, the Russians, they won't let us investigate, so we can't figure out whether there's an alternative theory that works. So according to the logic of the people who say, unless you know what else is true, then you have to go with the exploding invisible unicorn theory. So unless we know why people get sick, of which we have approximately 50 or so other reasons, diet, fear, social isolation, bad water, bad food, electromagnetic fields. You can go on and on. Alex Eck has a whole long list of 50 or so things. We outlined them in various books that I've written. Anything that pollutes your water or changes the energy field will make you sick. No virus needed. But they seem to be saying that unless you can prove some other thing is the reason for these symptoms which don't correlate with any disease, therefore, I'm going with the old imaginary theory that it must be a virus, it must be invisible, exploding unicorns, and that's just the height of absolute nonsense. That is not how rational thinking, logic, or science is meant to work. So, again, thanks for joining me, and I look forward to seeing everybody in our summit. I don't think I'm going to do something next Wednesday as I prepare the final push to get it as close as I can for the summit, and so we can have a really interesting and good time. Thanks, everybody, for joining me once again, and get involved. Write those letters, write those emails, give people your tweets and Instagram, give them your feedback. Say, we've had enough. We want real questioning happening here. And that's how we will move this needle. Take care, everybody.